Quick revision of nail disorders. Hello dear students, myself Dr. Maddineni Srinivas. So let us begin the discussion without any further delay. Nail matrix is going to produce the nail plate which is visible and the portion which you can touch and feel. Nail bed is the structure on which the nail plate rests upon. Proximal nail fold is going to cover the nail matrix proximally. Growth rate of the nail is 3 millimeters per month for fingernails and 1 millimeter per month for toenails. Leukonychia, which is whitish discoloration of the nails, is of two types. One is true leukonychia and the other one is apparent leukonychia. If the problem is in the nail matrix, it is true. Example is yes, arsenic poisoning producing Aldrich-Mees lines. Whereas apparent leukonychia problem is in the nail bed. What are the important examples which you have to remember? Muircase bands in which there can be underlying hypoalbuminemia nephrotic syndrome. Half and half nails, Lindsay nails, which is associated very importantly with the kidney dysfunction, chronic renal failure. Terry's nails, in which we are going to have more than 90% of the proximal part of the nail appearing white in color, and this is commonly seen in liver cirrhosis. Okay. Some of the important signs or lines and important terms in nail which you have to know are Bewes lines, which can be they are having the term lines, but they are actually the transverse or horizontal grooves in the nail plate because of some severe systemic illness. Koilonychia, spoon shaped associated iron deficiency anemia. Splinter hemorrhages can be seen in infective endocarditis. Onycholysis, I hope you remember, separation of the nail plate from the nail bed. This can be seen in psoriasis, and also it can be a feature of onychomycosis, right? Onychogryphosis, ram's horn nail deformity, right? And coming to infection of the nail folds, what is it called as paronychia? If it is because of bacteria staphylococcus, acute paronychia, and we are going to treat it with antibiotics. And chronic paronychia, most frequently it is associated with Candida albicans. C for chronic paronychia, it can also be associated with contact dermatitis, which is going to form the other C. So contact dermatitis. So you can remember 3 C's, right? I hope this video is helpful. So please do that like button. So let us continue the discussion with the green nail syndrome due to the pseudomonas infection, which is going to produce this greenish discoloration on the nail plate due to the pyocyanin or pyoverdin. One more interesting important finding on the nail is nail pitting. Okay, so remember in the psoriasis and also in the alopecia areata, this nail pitting can be seen. How can you differentiate? In alopecia areata, the pitting is superficial, regular and fine pitting. In psoriasis, it's going to be deep, irregular and coarse pitting. Very important differentiating point between these two. What was the pathognomonic sign seen in the nail psoriasis? Yes, very good. It is the oil drop sign, which is also called as salmon patch. In the onychomycosis, very important, you can see small tunnels which are present in the nail. These are nail tunneling, very characteristic of fungal infection, onychomycosis. And if you remember in the lichen planus, what is the term called as pathognomonic? Dorsal pterygium. Dorsal pterygium is going to be seen lichen planus. Here it is geometric pitting, that is regular pitting which is seen. Coming to the most common presentation in the psoriasis, yes, pitting is the most common presentation, whereas in nail lichen planus, very interestingly, exact opposite, thinning of the nail plate is very characteristic common feature, most common feature in the lichen planus. What is the most characteristic feature of nail lichen planus? Yes, it is pterygium. Remember this very important point. Subungual hyperkeratosis, material present below the nail plate, can be seen both in psoriasis as well as onychomycosis. How can you differentiate both these conditions? Remember dear students, tunneling of the nail is seen in onychomycosis. Pitting of the nails is seen in psoriasis. So these are the two important differentiating points between these two conditions. What is the advanced stage in the nail psoriasis? It can be complete separation producing onycholysis. Total dystrophic onychomycosis is complete nail will undergo dystrophic changes in the onychomycosis. And here in the lichen planus, we can see the complete nail loss, which is called as anonychia. And here remember, dear students, alopecia areata, the patients are going to have the non-scarring type of alopecia hair loss, which will be complete hair loss, which will be associated with exclamatory mark hair sign, and it will be having swarm of bees appearance on histopathology. And what is the treatment we are going to use for alopecia areata hair involvement? It's going to be intralesional steroids with triamcinolone and estonate. So I hope this video is helpful. If so, please do that like button, and also do hype this video so that it will reach more number of students and I will feel motivated. And if you are not yet subscribed to this channel, please do subscribe, and you can watch the entire playlist in the first comment and also the description. Thank you so much. Happy learning. Sarvam Sri Krishna Sarvajana Sukhana Bhavantu. Bye bye.